Hi guys, Kane Harrison here. Welcome to the PAI Medical WeGrowHair.com Medical Minute. I'm joined by Clinic Director Michael Ramsey. Good morning, mate.
Thank you, sir.
Fantastic to have you here.
It's great to be here.
We're going to walk through some of your fantastic procedures and some of perhaps the patients that we can treat at PAI Medical WeGrowHair.com. Let's talk about female hair transplant first and foremost.
Okay, so a lot of people don't realize that females can have hair transplants. For the longest time, it was sort of a male-oriented type of thing, but today that's not the case. So with females, they'll tend to thin through the top. They don't bald necessarily like a man might, but they thin through the top and sometimes on the sides. And for patients that thin, female patients that thin mostly on the top, we can harvest hair follicles from this donor region, and sometimes we can harvest hairs from the side area. And then we take those hairs and we move them to the area where the woman's thinning. So for females, a lot of times what they notice is they'll notice more and more skin showing through their hair. So they don't, again, bald, they just see more scalp. And so we go in between the hairs they have in the top and plant new hairs in and around those hairs. And one of the benefits of a transplant is when we take hairs from the back, those hairs tend to be a little bit hardier, more resistant to thinning. So when we place those in the areas where the patient's thinning, we're adding a hardier, healthier hair that's much less likely to thin as they get older. That can happen. You know, not every woman is a candidate for female hair transplants, but we have two options to help them: robotic and the traditional option. And when we meet with them, we can sort of ferret out their concerns, their goals, their expectations, and then match up the best technology to meet their needs through hair transplants.
Fantastic. I mean, I know that it's embarrassing for guys to be able to have thinning hair, but I imagine for women it can be quite devastating. I know that you and your staff definitely look after any client who comes in. You can whisk them in and whisk them out, and no one will even know that they're there. Talk about that.
So the privacy nature, women in particular are very unnerved about hair loss because they feel more ashamed. Like you said, men lose their hair. Yeah, it bothers some men, it bothered me, it bothers lots of men, but not all men are bothered by it. All women are bothered by hair loss if they have it. You can be sure of that. So they'll wear wigs, they'll wear scarves, they'll color their hair, they'll tease their hair, they'll perm it. They have all these sort of tricks in their pocket to help them manage their thinning. But the reality is they're thinning. So when they come in to meet with us, we're very cognizant of the fact that it's a sensitive issue. They often will meet with myself or our female senior medical consultant, and she's aware of hair loss. She's experienced some herself, and she's done some things to help her through her hair loss issues. So we go over, first of all, we do a complete hair and scalp analysis with a video microscope. And then we assess, the candidacy for their options, and then we carefully and gently explain what those options are and how we can help them get to where they want to be.
Fantastic. Michael, thank you so much for talking us through female hair transplants. This has been PAI Medical Minute. And don't forget to jump online at WeGrowHair.com and talk to Michael and the fantastic staff at PAI Medical WeGrowHair.com. We'll see you next time.